Hi everybody. Hi. Welcome to the webinar. I am new with this. This is a new medium for me. What it means is I was really supposed to be alone in a room talking to a white wall and imagining that 100 people are listening. And because that seemed a tad bit crazy, I have here 2 interns that are in the room with me so that I don't feel I'm talking to the wall imagining people are listening. So this is just so you understand where I'm coming from. It's a little bit different than if we are meeting in person. It's great though, because this enables us all to be here and share this. So on my way here today, I was thinking about how I would talk to you and how I would address this issue in a way that's meaningful and to where I can make a point that is useful to you and helpful for treating addiction also. It's a very complex disease that we're talking about here, and we are understanding addiction and alcoholism as a disease now, and it is a chronic disease. It is progressive, and it requires ongoing treatment. I usually tell people that I am also in recovery because it helps those people that are in recovery to feel that they are more understood, which is strange because you wouldn't expect a doctor that heals your broken bone to also have a broken bone at the same time, or a psychiatrist to also be schizophrenic in order to relate to a schizophrenic. And yet with alcoholics and with addicts, we expect that. And so it can be strange to a person hearing this and thinking like it doesn't make sense. But the reason is that alcoholism, it can look as if it's about the voluntary decision to pick up a glass and drink it and then put it back down and then repeat this until someone passes out. But this is really not what it is. Imagine, most of you have seen Romeo and Juliet, yes? This love affair that is over life size, that is more important than life itself, and people are ready and willing to die for it. And imagine alcoholism like that. Another way to imagine alcoholism is to imagine that you are starving and you are so hungry that you're going to faint from it. And then Nancy Reagan standing there with the sign saying, just say no. Imagine that. To where it angers and it frustrates you to where you say, I can't say no, and I don't care, and if you tell me I die tomorrow, I don't care. Right now, there is this urgency here with what I'm feeling. Amy Winehouse, who died at the age of 27 of this disease, she has this beautiful lyrics, some of which I have here on this post of the PowerPoint, this page of the PowerPoint, where she writes, I died 100 times. And in another song, she sings, I told you I was trouble, you know that I'm no good. If you hear this, this is very typical for an alcoholic way of looking at things. And also I want to tell you another story, a story of somebody that I know. His name is Louis, and he stood to inherit a spectacular fortune. Spectacular. Many, many, many millions of dollars. And there was a lawsuit about the legacy, and the lawsuit lasted for 7 weeks, and he showed up. His codependent girlfriend came along, and he showed up every day. He looked good. And then the day came for his deposition. And he was supposed to be questioned after lunch, and during lunch, he wanted to drink 1 glass of red wine. And his girlfriend begged him. She said, please, please, not now. You can get drunk as you want after. Just please not now. But and he said, no, I have to, like, just 1 glass. And she said, please, just not now. Any other time, just not now. And he did drink the wine. He only drank 1 glass. But what it does for an alcoholic like him, it changed his personality in a way that it wouldn't do that to a normal person or healthy person. It changed his personality in such a way that he was just not as humble and charming and likable and believable as he was a minute before he picked up this 1 little glass of red wine. And so in the courtroom, he came across as not really likable, as not really, like, not having such dignity, and not being so serious. And consequently, the judge simply didn't really like him. He came off as arrogant. And it was just, and everybody in the courtroom noticed it, and he lost the case because of his presentation on that day. And it was for 1 glass. This is something that makes no sense to anybody else who has no experience with alcoholism. It is not about the glass. And I want to read you a little bit of a little poem that I wrote. The poem is called The Ism or Geriatric Children. I'm just going to read a little bit. Alcoholism is not about the type of substance used, be it powder, pill, or liquid. It doesn't matter how it's done. The ism is about being a stranger to planet Earth, ill-equipped to care for the body given, ignorant to what anything means, and disconnected from everyone. In spite of intelligence as well as talents, potential, assets, and gifts, eventually the freedom of choice is lost. Distorted perceptions keep him stuck, and he turns into an old child. No progress to be had. Experiences are not processed consciously and integrated properly. No maturation and no empowerment. At the mercy of legal restrictions, translucent to authorities and institutions, he regresses to parental control or the exploitation of a string of strangers. Addiction is a complex syndrome to be understood beyond the lack of age-appropriate behaviors on a plane above the physical. So this starts that poem that I wrote, and it's about one of the 3 main aspects of alcoholism, the spiritual aspect here. But let's go to the psychological aspects as well. Because this is also a very important aspect. So there is the spiritual aspect that I just touched a little bit, and now there is the psychological aspect where the alcoholic is described as restless, irritable, and discontent, and also selfish, self-centered, and inconsiderate. As I said with the example of Louis, who lost the fortune because of 1 glass of red wine, which is such a tragedy for himself and for his family, and really is so typical for an alcoholic. There's also a lot of talk in Alcoholics Anonymous about character defects. And character defects are describing aspects of behaviors, of habitual thought patterns, habitual behavior patterns, emotional dysregulation, there's a change here. Wait. I'm sorry. My screen changed here. Okay. The alcoholic has these he's torn inside. He has ambivalence. He doesn't know what to do in situations that he's supposed to know what to do as an adult. He has a disease of perception. He perceives himself as threatened when he's not. He thinks people are against him when they're not. He thinks he has to be assertive when really he has to just show up. Everything is very extreme for the alcoholic. The alcoholic is pained by his own existence. It's a very it's a disquieting internal climate. Reality is not experienced as friendly or as doable. The alcoholic feels he can't do life. I always say he, but of course the same goes for women. And then there is this concept that Freud came up with, eros and thanatos. Eros relating to the power of love and going forward, moving forward with life, embracing things, welcoming things. And then thanatos, the death wish, the force of destruction and aggression and fighting. And so it is understood that we have these two forces within us. And thanatos is really a very important aspect of being human because it helps us to fight for survival and to stand our ground and to do what is necessary when you're meant to protect yourself. But I always think that for the alcoholic, the thanatos side is just way more developed, bigger, stronger. There is a bias towards that force to where the alcoholic tends to be defiant also and standing up and being up in arms when there is no real reason to do so. And because of all of that, there is a tendency, of course, to try and escape reality. Reality is just simply not experienced as pleasurable or pleasant or doable or manageable. None of those. And so the alcoholic needs to escape, withdraw, isolate, or be up in arms. All things that are not really very comfortable. Not for the alcoholic and not for other people that are dealing with him. So there is a reason for all of this, of course, and it is said that the alcoholic is born with a genetic predisposition to be a certain way, to have a bias, to have a tendency to behave in certain ways. And the way that one way of looking at it is the physiological aspect, which is the addictive brain. And there are four aspects of the brain circuitry that are considered important here. One is the opiate system. And the opiate system is about creating control and creating a sense of comfort when there is some pain, some emotional pain, discomfort, or also physical pain. The opiate system provides endorphins, which kind of makes us feel better again when there is a dysregulation in that area. And then there is the dopamine and reward system. And with that, there is the dopamine is about going forward, being curious, engaging in life, feeling confident. And the dopamine system is located in the midbrain, and what's related with that is also the fight or flight system, which the fight or flight system is a very important aspect of survival through our evolution, but it's about like staying alive and like not dying, to where it's in the way that we live these days, our survival isn't really threatened all that much or all that frequently to where we would have to go to fight or flight response. But if the system is a little bit compromised, which it is for the alcoholic, then the person will go to fight or flight mode like frequently throughout the day, and then that would dominate the overall mode, and it would interfere with a clear way of thinking, and it would interfere with a sense of comfort. It's like a very extreme way of experiencing reality. And one aspect also is that for the alcoholic, the dopamine system seems to be a little bit inefficient to begin with, or fickle maybe. And so then if you introduce substances, they usually tend to make up for it and increase or mimic the dopamine in the brain, and so they compromise the system even more, to where alcoholics, if once they get used to substances or alcohol, even feel less comfortable, and then they feel more and more dependent on putting substances in the system. And then there is the adrenaline system, which in response to all kinds of situations, the system is flooded with adrenaline for the alcoholic, where that wouldn't happen so much for a normal person. For a normal person, it would be more a flooding with adrenaline is if they, like, let's say, almost get into a car accident because somebody is cutting them. But for an alcoholic, they get flooded with adrenaline if somebody opens the door too quickly. There is like a frequent flooding with adrenaline, and it's very cumbersome and very extreme, and it interferes with the clarity of thinking also. And then you have, with this, you also have the impulse control deficiency, where alcoholics don't really have good impulse control. Once they have a thought that they want to do something, then they're already moving. They don't have the ability to control that or to not act on it, because it's experienced with such intensity. And it is a helpful concept to think of the brain chemistry, because it takes out the shame. I've been facilitating groups a lot on the addictive brain and the physiology, and people always find it very helpful to understand that the addictive brain is just a little bit different, because it takes out the responsibility in the sense for having this condition. It doesn't take away the responsibility for acting on it, of course, but it's not it's not the alcoholic's fault that this is in place like that, to where the internal climate is just so volatile. And so this is a helpful thing to introduce with alcoholics. So in order to understand this, it's good to look at, you know, with the opiates, opiates being analgesics, there are lots of substances that are affecting, that are addressing each one of the aspects of the addictive brain: the opiate system, the dopamine system, the adrenaline system, and the impulse control problem. And so this is something to consider also in treatment, because alcoholics usually want to continue with substances. I have mentioned on this page here, it talks about the fight or flight response some more. There is also the concept of the amygdala hijack. The amygdala is a structure in the midbrain also, which is a twin structure. It's said to be almond shaped. It's a little bit kind of above the ear there somewhere. It's in the midbrain on the sides, and the amygdala hijack is a physiological component that has to do with the reaction to these to experiences that would be stressful, threatening, especially if it happens early in life. And in my experience, most alcoholics have survived some kind of adverse childhood experiences, either with their parents very early on, traumatic, abandonment, neglect, violence, sexual. There's a lot of that, and also there is the aspect of the hypertrophy of the amygdala, which comes from such experiences where hypertrophy describes where the amygdala kind of gets a little bit bigger because it's always hyperactive, and so it gets bigger, and there is like a bias towards the amygdala always dominating in the brain. And the amygdala is normally understood as a structure in the brain that interprets sensory input. But for people that have survived adverse childhood experiences and often repeated over long periods of time, and they have the amygdala hijack, it always goes to this fight or flight response, and it always interferes with clarity of thinking. And so it makes it hard to deal with life in a comfortable way, because life is experienced as threatening. And this has a lot to do also with very early childhood attachment, where babies are often not with a safe enough environment, either often because the mothers are alcoholic also, or the mothers can be mentally ill or emotionally dysregulated or not present, or the children pushed around, or divorce situations. There's a lot of difficulties throughout life. If you ever listen to any alcoholic, you usually don't hear a story of a very peaceful childhood. It's almost always about adverse childhood experiences. So this is the background of the behavior. So what we're talking about here is like a physiological component, a physical component, a psychological component, and then a spiritual component. So these are aspects that it's good to consider this, and to know that these are aspects that ought to be addressed in treatment as well. So here, the emotional dysregulation is also described as a lack of self-soothing mechanisms. Normally people that get upset, it's said that they calm down to a more comfortable way of being within a few minutes. For somebody who lacks self-soothing mechanisms, like most alcoholics do, it can take hours or even longer to get back to normal. Alcoholics don't really know how to calm themselves down by themselves. And so they remain in this unfriendly emotional climate, and they feel that they need to act out on it. And they have this, they're torn with confusion and with impulses, and then there is a lot of guilt and shame develops more and more over being this way, and often not knowing why they are this way. And then there is guilt over behaviors such as not being able to stay sober, or doing things that are embarrassing or dangerous or endangering others, or alcoholics changing their changing their behaviors suddenly, and not knowing why, going from being friendly to all of a sudden being angry or violent or aggressive. It happens. It doesn't happen to everybody, but some alcoholics get tearful and just inappropriate behaviors, and there is so much guilt and shame, and eventually this lowers the self-confidence and self-love. It's hard to love yourself when you're doing all these weird behaviors and you don't know why, and you repeat it anyways. It's very hard to love yourself. And so that causes depression, and it causes anxiety. It has more and more, it includes more and more aspects of the overall psychological landscape. It pervades everything, really. And so then there is a lot of resentment against self, and the alcoholic feels like why did I do this? There's like this self-hatred and remorse and regret, and this is so horribly unsettling that then there may be a tendency to blame and project out and say, well, maybe I behave like this, but this is because this is what they did to me when I was little. This is what my mother did, and this is what my father did, and this is what my girlfriend did. They deserve that I act out like this. And so then it's like there is a resistance that comes up, and a defiance to just kind of protect a little bit against all of this uncomfortable and behavior that the alcoholic doesn't know how to stop. There's like a powerlessness about it. And the way that this all plays out, if you put all this together, it's hard to have any insight, because ultimately the alcoholic really can't know what he's going to do. He may drink a glass of wine and have a personality change or not, or he may drink a glass of wine and then continue to drink and black out and do unspeakable things that he may not remember afterwards. It's hard to have insight when your mental process is so disrupted. the mental process of an alcoholic is always discontinuous. There is no way of comfortably integrating more and more life experiences like a normal or healthy person would do and growing with it. There is a lack of that. There is a lack of insight, and so consequently there is a lack of integration, and then with that you don't really develop good judgment because you don't learn from your experiences, and you know that. So it goes back to that shame and blame thing where you're not sure, why did I do this? Maybe it's because of you, or maybe it's because of you were not there. You know, there is always some of that, and because there is this intensity, the impulse control is very compromised. It's like you just have to do something to relieve tension. The immediate tension relief is really is experienced as of the utmost importance. Let's move forward here. So addictive behavior comes in to provide some relief, to create some artificial and chemical euphoria, to self-medicate and self-soothe and downward regulate all these states that are otherwise wild and unmanageable. And so it is really, it's not, it may not seem doable for an alcoholic to say, no, thank you, I will not now shoot up heroin, or not today, today I will not smoke the crack pipe. It just doesn't seem like it would be at all interesting to do. For an alcoholic, it seems like whatever tomorrow. I don't care whether I die, because there is such suffering that death or prison cannot even be considered. There is much more immediate relief necessary for the alcoholic. And in the end, alcoholics become very lonely because they misbehave so much, and they're inappropriately sexual or violent or whatever they do, and so eventually they withdraw and isolate, and people can't handle it anymore, of course. So when people come to treatment, usually they're really broken, and they're desperate, they're broken, and at the same time they're not really motivated, because the ambivalence of the alcoholic is about relieving discomfort and wanting some happiness, but they don't know how. What they do know is how to get loaded. That's really all they know. They don't know how to be happy, how to build a life, how to build relationships, how to create a life where you're respected by others, respected by yourself, where you feel useful. So recovery has to really introduce that as like a new thing to have like a psychic change, a reorientation, to open a whole new world. And it's tricky to motivate a person to do this. It requires, I always think that when I'm dealing with people early in recovery, it's just about bringing some hope. Just that. It can be done. It's doable. It's possible. You can do it. And it's not about me taking your dope and then you're left to suffering. It's not that. It's about reducing suffering and getting more comfortable and getting better and having actual improvement and healing going on. So in treatment, there are several levels of care. We usually would need to see that somebody is kept safe, which with some substances there is a risk factor with high blood pressure or seizures. So it's often recommended to go to detox at a hospital just to keep people safe and to give them some medications to where it's not too uncomfortable. And then the patients are, it's usually suggested to go to a residential rehab for 30 or 90 days. Usually it would take more time than that even. Usually it's suggested to give it like a year for stabilization. It takes some time to change habits. There's all this research that says that it takes about 90 days to change a habit. So there would be that. Another option is partial hospitalization, where people go to a day treatment and they also stay in a sober living environment. But the day treatment would be every day, all day, to teach things, psychoeducation, to go to Cog Lab, to go to groups, to have individual therapy, and all that in an intensive manner all day long, to keep people occupied and distract also from discomfort. It can be hugely important. Also, there is a social environment there with peers all day long. All these factors help to make it through those days, those early days where it's rough. And then the next lower level of care is the intensive outpatient treatment, which is usually 3 hours a day, either 3 days a week, or it can be 4 or 5 days a week. Then it's always a good idea to have individual psychotherapy, because there is usually a need to integrate changes and to process trauma and to feel the support of a professional, and to feel like you have an ally ongoing regularly for like a more longer term. Sometimes people only go to psychotherapy when they are in crisis, but it's of course a bias in my profession to stay in therapy and to continue to stabilize until the change has been in place for a while. And then there are the 12-step programs, which the 12-step programs they offer, the 12 steps programs really offer a formula for psychic change. They help, the steps help to let go of resentment, to take responsibility for one's own behaviors, and to maintain, to move to like a life with dignity, and to maintain that. It helps to look at one's own behaviors and the consequences of these behaviors, to really understand how the chaos that the alcoholic has created, how did that happen, and to see how can I act myself. It's very, very helpful. I can't overstate how helpful such an ongoing program can be. It's usually not sufficient in the beginning, especially if it's complex with substances and alcohol, and if there is a dual diagnosis. The 12-step programs are not sufficient. But for an ongoing support program, it's fantastic. And the spiritual path also suggests to look for some higher power, to look for meaning in life, for one's purpose, to make oneself useful, and that also helps to get out of self, to kind of get out of always thinking about one's own well-being, the selfish, self-centered, and inconsiderate aspect that I mentioned in the beginning. And it's a little bit counterintuitive in with the directive, let go, let God, because alcoholics, when they're fear-based and uncomfortable like that, they try to enforce and control an outcome. In the program helps to kind of handle that aspect. And also, there is the peer support, which is hugely important to help to not feel so alone and so ashamed, and to feel like we're in this together and we can do it together. And I don't have to isolate anymore. I don't have to withdraw from people anymore. There are other people that feel like I do. It's helpful. It's helpful to feel that people are not alone when they're supposed to not be drinking and using, because that's a scary thing initially. In psychotherapy, I already mentioned, it's a corrective emotional experience. A lot of the patients have experienced very troubling relationship with their family, and so the establishing a good rapport with the therapist can be very helpful with that, to reestablish trust and to have a role model of somebody who is kind and reliable and provides safety. Many people haven't had that, and so the therapeutic relationship is eventually has the chance to process and heal trauma, and that's of course a gradual process. It doesn't happen overnight, and it requires the safety and the trust that can be established with a therapist, and eventually it can become doable to befriend reality. If you put this together with also the initial treatment and the 12-step program, if you have all of this as like a package deal, as a comprehensive program, it can really give the chance of maintaining sobriety. It really does. But sometimes people underestimate it, and they think, oh, I just won't drink, I just won't use, I threw my substances in the toilet. That's not a program of recovery. That's just a method to regret something, some other thing to regret. So I have handouts that address something that I offer with my patients and in the group and also in individual therapy. It's daily mental hygiene tools that I feel are really most important to. Oh, and our time is almost up. So I have these handouts for you to look at. It's about something that people can do in the morning when they get up, when they feel uncomfortable, from getting up until they get to a meeting, or until they get to their program, or until they get to their therapy, so that they can establish some tools to do alone at home. It's very helpful, such as breathing exercises or affirmations, such as, for example, I'm allowed to be happy today. So thank you for listening. I think we now have time, a few minutes time. This is here the cover of my book. It's on that same topic. And we have time for questions now. Does anybody have any questions or comments?
Jasmin, thank you. That was so powerful, Jasmin. I really loved what you spoke on, and I'm so excited to read your book. I really loved when you said pained by his own existence. And that is so the truth in our addictions. So I really just, I love that we have a solution, and I love that I was able to hear you today. That was powerful. We do have questions. Question from David Burke. He writes, "Good morning, Jasmin. My name is David Burke from Summit Estate Recovery Center in Los Gatos, California. He is starting a craving identification group, and he is letting the clients know about neuroadaptation, craving, and how it affects the brain with post-acute withdrawal. He wanted to know if you have an education piece on it and what's your approach."
Thank you. For the post-acute withdrawal syndrome, what we're dealing with is mostly depression and anxiety. And so anything that would counteract that would be helpful during that time. Prayer, meditation, affirmations. You see that on my handouts. My handouts are exactly addressing this particular question. It's things that you can do when you're by yourself, such as, let's say, you get up in the morning, read the big book of Alcoholics Anonymous, or some other spiritual writing, or write, or call a sponsor, or go to a meeting, breathing exercises, go for a walk, anything that would introduce some soothing, some relief is very important, because people at that phase are very excitable and volatile.
Sure, sure. Okay, next we have a question from Sage Breslin. Sage asks, "Do you believe that the use of SSRIs, which may increase dopamine, will assist the alcoholic tolerate the experience he or she has?"
I very much appreciate this question. It's more a question to address to a medical doctor. I'm not a medical doctor, so I'm not supposed to really give advice on these kinds of things. However, the SSRIs are selective serotonin reuptake inhibitors, such as Prozac, and as such, they can assist with depression. They're not addictive, and so it can be a huge help for somebody who struggles with major depression.
Okay.
And it can make it doable. It can make all the difference for such a person. It's not for everybody, and it may not be a permanent solution for anybody, but it can be a big help, yes.
Okay, okay. Next, Rose, she wanted to know, and this is actually going to be for everyone, she wants to know, do we have a chance to download the PowerPoint? She would like to see it again, and she wants to save it and print it because, like I said, it was powerful. And I did want to let everybody know, absolutely you do. You will go to our website also if you are earning a CE credit. We will be putting the handouts on our website, sovcal.com, and you will be able to fill it out, and then you will be receiving credit. It takes about 48 hours. Also, I wanted to let you know, if you would like to visit Jasmin's blog, again, great tool to have. It's powerful. You will thoroughly enjoy it. Please go. It's one word. It's going to be Voice of Recovery. That's Voice of Recovery, period, blogspot.com. A lot of great information for the alcoholic in treatment, the alcoholic who's still suffering, or just to gain general knowledge. And her website, www.jasminrogg, that's going to be JASMINROGG.com. So yes, to answer your question, Rose, the PowerPoint will be up there. I then have another question, Jasmin. You are just pretty popular. This is from Albert, and he wants to know, what are your thoughts about starting a college recovery center on a college campus?
That's a good thought. I think that would be very, very important, because what I hear in this country, the college students drink a lot, and then for some of them, it's just a little bit a substance use disorder or a substance abuse, and for some of them, they can slide into alcoholic behaviors and combine it with other substances, and then there is also the abuse of pharma drugs. So yes, it would be very important to educate and offer support for stress. Mm-hmm. Yes. Mm-hmm. Good thought.
Absolutely. And I think that is pretty much all of our questions. And if you needed or wanted to, if you wanted to see or hear Jasmin, please do visit her blog spot. I'm sorry, I was actually seeing if we were getting another question. And we are. A woman says, I have a client in a few minutes. She wants to know more about the CEU credits. So again, it is going to be on our website. You can get that information. It will be 48 hours. And again, please go read Jasmin's book, To Hell and Back, How to Have Feelings and Stay Sober at the same time. And then voiceofrecovery.blogspot.com. You are always amazing, Jasmin. We were happy to have you. Thank you so much for your time.
Thank you. Thank you for listening.